Welcome to Module 2 of Medicaid and Food Security 101. This module provides an introduction to Medicaid eligibility and benefits, including who is enrolled in Medicaid and what is covered by Medicaid. This module will also explore food insecurity within Medicaid enrollees and the two major federal programs that address food needs. By the end of this module, you will have information about who is served by Medicaid and the federal food benefit programs and where there may be opportunities for improvement in how these systems meet the needs of the community. The Medicaid program is designed to serve low-income individuals. Legally, Medicaid must be offered to certain populations, including low-income children and people who are pregnant, certain low-income parents and caretakers, and most individuals with disabilities. In addition to these mandatory populations, states can choose to add additional populations. For example, adults who are low-income but do not have dependent children are not a mandatory population. However, as a result of the Affordable Care Act, states have been encouraged to expand coverage to this population. Understanding whether or not a state chooses to expand Medicaid is important because it highlights that, in some states, a person would be eligible to receive Medicaid along with innovative benefits, such as those addressing food, while that same person in another state may not be eligible for the Medicaid program. In order to know how the Medicaid program in your state might impact food insecurity, you have to start by understanding who in your state is eligible to receive Medicaid. Medicaid covers a diverse population of residents, representing individuals of every race, ethnicity, and walk of life, including children, seniors, able-bodied adults, and individuals with disabilities. Across those giving birth, 40% are enrolled in Medicaid at the time of delivery. A common misconception is that most Medicaid members are unemployed. However, some data indicate that 61% of able-bodied adults enrolled in Medicaid are in the workforce, including many essential workers, such as healthcare employees, transportation and waste management staff, and other municipal service staff, grocery store workers, and other critical employees. Like private insurance coverage, Medicaid programs have a set list of benefits. All states must offer the mandatory benefits defined by the Centers for Medicare and Medicaid Services. Examples of mandatory benefits are listed here. Unlike private insurance, Medicaid has a unique mandate to provide any medically necessary service, including those not specifically defined in the benefit plan to children and youth. This mandatory benefit is the Early and Periodic Screening, Diagnostic, and Treatment Services benefit, which requires that Medicaid programs reimburse for the, to quote the regulation, early and periodic screening and diagnosis of eligible Medicaid beneficiaries under age 21 to ascertain physical and mental defects and providing treatment to correct and ameliorate defects and chronic conditions found. This benefit means that any service that is medically required to promote a child's health and well-being should be covered under Medicaid, including services not typically covered by Medicaid or other health insurance. In addition to the mandatory benefits, there is a large list of optional benefits that states can choose to offer. Some, like prescription drugs, all states have opted to include, while others, like dental care, vary greatly state by state. In the module titled Medicaid Policy Levers to Address Social Needs, you will learn more about how states can offer nutrition-related benefits. A conservative estimate is that 22% of Medicaid enrollees are food insecure. According to one survey, Medicaid recipients experience far greater rates of food insecurity across many indicators compared to the general population. About 1/3 often purchase less healthy food options than they otherwise would because of lack of money, more than twice the rate of non-recipients. Similarly, nearly 1/3 often purchase less food overall because of money, nearly 3 times the rate of non-recipients. A similar number worry that their food will run out before they get money to buy more, compared to just 7% of non-recipients. And 43% of Medicaid recipients say they often skip at least one meal a day, compared with 28% of non-recipients. Many of those experiencing food insecurity are eligible for the Supplemental Nutrition Assistance Program, or SNAP, a federal program administered by states. SNAP enrollees are provided with a cash benefit in the form of a card that looks like a credit card, which can be used at most grocery stores and farmers markets. While there are some restrictions on what can be purchased with this card, it provides meaningful support to many families so that they can buy fresh produce, meal ingredients, and other staples. SNAP helps families with low incomes afford foods and is linked to improved health outcomes over the long term. SNAP participants are more likely to report excellent or very good health than low-income people who don't participate in SNAP. SNAP is also linked to lower medical costs, and some studies show an association between SNAP participation and a reduction in healthcare costs by as much as $5,000 per person per year. Yet, based on 2020 data, about 22% of people eligible for SNAP nationally were not enrolled. And in some states, that rate reaches over 60%. SNAP applications can be confusing and complex with time-consuming documentation and interview requirements. Additionally, an equally difficult recertification process prevents individuals from remaining enrolled in the program. Like many public benefit programs, there's also often a stigma associated with being enrolled in SNAP. And while these barriers are real, they also present an opportunity for the healthcare system to intervene. Healthcare payers and providers interface regularly with community members who are not connected with SNAP, WIC, and other food resources. Indeed, healthcare has a track record of improving enrollment in benefits. 91.9% of people eligible for Medicaid or CHIP participate. The Special Supplemental Nutrition Program for Women, Infants, and Children, better known as the WIC program, serves to safeguard the health of low-income pregnant, postpartum, and breastfeeding women, infants, and children up to age 5 who are at nutritional risk. This mission is carried out by providing participants with nutritious foods to supplement diets, nutrition education, including breastfeeding promotion and support, and referrals to health and other social services. The foods provided through the WIC program are designed to supplement participants' diets with specific nutrients, including baby foods, fruits and vegetables, and whole grain breads and cereals. WIC benefits are not limited only to food. Participants have access to a number of resources, including health screening, nutrition and breastfeeding counseling, immunization screening and referral, substance abuse referral, and more. The average monthly WIC-eligible population totaled 12.5 million in 2020. Like with SNAP, there's a long way to go with improving enrollment. In 2020, only about half of people eligible for WIC were enrolled. Access to and participation in SNAP and WIC are key components of any strategy to reduce food insecurity and nutrition-related chronic diseases, and as such are essential elements of improving health and racial equity in the U.S. Leaving this module, we hope you will remember that each state has different criteria on who is eligible for Medicaid. Medicaid benefits include a mandate to support treatments that address the health needs of children, and there are Medicaid enrollees who are eligible but not enrolled in SNAP and WIC. In every state, many Medicaid enrollees are food insecure, and there's an opportunity to connect those enrollees with SNAP, WIC, and other food resources. Leaving this module, we encourage you to go out and find out more about who in your state can receive Medicaid and what benefits are covered. The state overview pages on the CMS website, linked here and on the references list for this module, will provide you with some information about eligibility and enrollment.